So let's just move along the agenda. We kind of have a surprise that's not in the agenda. So we are all educated individuals. We know health has a human direct impact based on our surroundings. We know that what we eat affects the way our body functions. We know that on a cellular structure, whether it be the sun that gets into our skin or whether it be, if we're not outside, we're missing that vitamin D, there is a direct correlation to our environment, to our bodies, and in tune to our minds. And the way we actually react to our planet. So next up, we're going to hear from Dr. Noreen. You may have seen her here already. If you haven't seen her, I'm sure you won't miss her. She's going to come up to the stage. She's going to give us a little more insight to her industry and the power of travel and whether or not just going on a holiday is enough to really impact your health, wealth, lifestyle in your mind and transform your health. Come on up to the stage, Dr. Noreen. We're ready for you. Give her a round of applause.
So kind. Okay. Hello, good afternoon, everyone. So day 3, it's actually good to see the area is actually a little bit more packed than I was expecting. So I'm Dr. Noreen Nguru. I'm a multi-award-winning medical doctor, wellness travel consultant, cognitive behavioral life coach, and also an independent luxury travel consultant, certified in CBT and mindfulness. And what I've done is combine all of my loves, so my loves of traveling and global exploration with my love of science and facts. And the facts are that traveling can be one of the most enigmatic kind of experiences that we can have that help further our sense of wellness. Okay, so that's me. When we look at the global workforce, we know that it's in crisis. A recent study by Statistica in 2022 showed that around the world there are about 3 billion people currently working, and as Asana found in 2021, 63% reported high levels, overwhelming levels of burnout. And we're in the age of the great resignation, of this quiet quitting phenomenon where workers and employers and employees, they are leaving work in droves, in high numbers, quiet quitting, in this face of overwhelming burnout and job dissatisfaction. And so this is just a little video. I don't know if it's going to play. Okay. Well, this was sort of a recent interview that I did with ITV News a couple of weeks ago in the UK. We have recently had over 100,000 nurses actually striking and walking out, and it's not something that they want to do. I remember striking in 2010, actually, when I just finished medical school, to talk about the poor working conditions, to talk about the fact that patient safety was being impacted by understaffing, by under-resourcing and undermining of healthcare staff. And it, since then, it doesn't look like much has changed. So I shared a little bit about my story yesterday and how I sort of came to leave the National Health Service, the epiphany that I had after working a 98-hour week during the pandemic and unfortunately becoming really unwell, was hospitalized for 3 days. And I think I was sitting there watching the replacement doctor who had come from another ward, trying to scurry around and, figure everything out. And there weren't any private rooms, so I was actually on the same ward that I'd been doing a ward round on. And I was listening to this background of patients complaining that their paracetamol was 10 minutes late and this was 5 minutes late, and I thought, I could have died. I'm utterly replaceable. And it was really that moment that I said, you know what, enough is enough, and I need to prioritize my wellness. And as much as I love being a hospital doctor, and I love that I'm having these one-to-one opportunities to be able to change people's health and promote health, I'm not promoting my health by staying in this kind of institution that is failing us all the time, both patients and healthcare staff. At the moment, hustle culture is becoming a thing of the past. You've got companies like Google and LinkedIn and Nike who've recognized that really the key to productivity, it sounds very simple, but is just enhancing their employees' well-being in the workplace and at home, because at the end of the day, we know that most of us spend up to a third of our working day or even more at work, surrounded by colleagues, maybe even more than you see your family and friends. So these companies have gone above and beyond to be able to change the thought process and that corporate culture of overwork. And I think employees themselves have really recognized the fragility of life since the pandemic. They're not really largely focused on money. What is a extra 2K, 5K, 10K bonus to me if I am in hospital or burnt out and I've got decision fatigue and brain fog? They're really focused on living well at work and at home. Again, this was another video that unfortunately does not look like it's playing, but that's fine. I think we sort of readily accept things like immunizations and taking vitamins, getting mammograms and cervical smears, and all these really great measures for preventing later stage disease. But things as simple as getting enough rest are overlooked and often discouraged, as I said, in these kind of corporate toxic environments where the later you stay, the more eager you appear. And when I'm talking about the therapeutic benefits of travel, these are some things that come to mind. Now, I'm wondering if there's any fact that I've put on here that anyone's shocked by. Please do come to the mic. We've got things like travel increases neuroplasticity, reduces occupational burnout, increases iodine in the body. Why would you think that travel would be increasing iodine in the body? Because of that exposure to sea life that you get when you travel to beaches. And I think something that I was really quite interested in is the link between traveling and heart disease. I found it utterly fascinating. There's one of the longest running studies or largest studies called the Farringham study of cardiovascular medicine actually found that they followed 12,000 men who were at high risk. These were middle-aged men at high risk of heart disease, and they followed them for a 9-year period. And sort of accounting for other factors, they found that the men who vacationed at least once a year were 5 times less likely to suffer from heart attacks and have heart disease and actually other health problems. And a lot of that is to do with the fact that we know that emotional stress and being in this chronic phase of kind of overwork and burnout, and you have high levels of your catecholamines kind of racing around, affects your metabolic health and affects your blood vessels. So these were sort of the facts that I, as a travel lover, really leaned into and thought to myself, this is amazing stuff. But not everyone seems to know just the extent of how you can use travel as a therapy. So really, I think the birth of prescribed wellness travel and what I do, what the doctor recommends as the world's first doctor to be prescribing travel as medicine for the mind, is I had the epiphany, yes, in 2020, but even prior to that, I do remember, this was 2017, I'd finished a stretch of 10 nights, and my reward was always traveling. If I did something arduous or hard, or I did a stretch of nights or something, I was going to travel afterwards. I was going to go to Bali, I was going to go to Rwanda, go gorilla trekking, something to kind of reinvigorate myself. And I just remember I was in Bali at the time, and I was standing at the base of Mount Batur. If anyone's been to Bali, it's beautiful. And I just remember feeling this peace and contentment that I had not felt in a very long time. And I thought to myself, how can I almost want to bottle up this feeling. How can I take this feeling back home with me? Having had these local exchanges, having had these thought-provoking conversations, and having my mindset changed by the things I was seeing, putting things into perspective. As I said, traveling helps with your cognitive neuroplasticity. It forces introspection. It helps if you're traveling in the right way, mindfully and purposefully. And at the time, I think I hadn't done enough research into travel to be able to come to a conclusion about how can I bottle this up, and how can I take these feel-good feelings home and make them last. Because I'm sure, as everyone knows, you go on a holiday and you have a really nice vacation and you feel amazing, you feel blissful. But then you come back home and you go to work and you're, doing the mundanity of life, and the grime of burnout starts to get back to you, and then you want to explore again. So it's how to make this a more long-lasting transformation. So, as I said, I have got the world's first physician-led wellness and travel consultancy prescribing wellness travel, really to combat occupational burnout. At the moment, I work with corporations and with individuals who are suffering from things like decision fatigue, from brain fog. They have really lost their sense of mind-body-soul connection. They're burnt out. They no longer have any job satisfaction. And I use travel as a catalyst. It's really the spark plug combined with my high-performance coaching. The amalgamation of the two helps them have that longer-lasting transformation, because as I've been doing a little bit more research with the University of Surrey, their travel team, we found that it actually takes 5 weeks for those feel-good feelings to dissipate. And so how can we help people carry on that ongoing transformation in their lives? And that's where the supportive cognitive behavioral therapy and life coaching comes in. So it's something that's really innovative, and it's taken the imagination of everyone that I talk to about it, and I'm so thankful to my clients for really believing in the in prescribed wellness travel. So how it works. As I said, I'm many things. I'm a multi-hyphenate. This is the ADHD. So what I do is I've amalgamated all of my specialities. So at What the Doctor Recommends, I partner with qualified healthcare practitioners, such as GPs, who we dual train as wellness coaches and travel consultants to be able to analyze a client's wellness travel prescription questionnaire. It's a very in-depth and long questionnaire. And I work closely with a directory of carefully selected wellness tourism partners to prescribe not only a destination for a client, but also to create a personalized wellness experience that's very experiential, that's very specific to them, that is targeted towards their current travel wants and needs and their goals. What is their mission from this? Is it to detox from technology? Is it to recover from burnout? Is it to challenge themselves in a way that is supported, yet they have got that sense of autonomy when they're traveling? And as I said, combining this with cognitive behavioral life coaching. So this is currently, I think, the old, or the way that most people travel is you overwork, you're not taking regular rest, and then the overwhelm comes, the burnout, the fatigue, the stress, the anxiety, and then people travel to rebuild their resilience. But what if it looked a little bit different? What if travel is actually a preventative measure? What if it's a preventative solution? So you're actually traveling with intent, you're setting goals, you're able to build these positive life coping skills that are transferable into the workplace. So you return detoxed and de-stressed, and you're more productive, and you're making this a regular pattern in your life. So I've been quite fortunate. I'm really excited about this, actually. We know that we're living in a sort of twin pandemic, burnout and poor sleep. Now, it's almost like a chicken and egg situation, because which came first? Are you burnt out? Then you have sleep disturbances? Or do the sleep disturbances cause the burnout? It's a fascinating topic, but I'm really proud to partner with Sleep Space. Sleep Space and Dr. Dan Gartenberg, he's also known as Dr. Snooze. He's a renowned sleep scientist and adjunct professor at the Penn State University. So he's created Sleep Space, which is the world's first integrated sleep tracker, and CBTI, which is CBT insomnia, coaching software that is also in parallel run with live travel coaching, live sleep specialist coaching. And these really customized sleep programs are based on the industry standard cognitive behavioral therapy. And one thing that I think really stands out about Sleep Space is its ability to integrate with your wearables, whether you've got an Apple Watch or Garmin or something like that, and it will accurately measure and enhance your sleep with sound and light integration if you have smart light bulbs. So I've actually put this QR code there if you want to scan it. If you don't have a method of scanning it and you would like to try out a 30-day free trial of Sleep Space, just connect with me on LinkedIn or find me sort of after this. So this is really the core of what I'm doing at the moment, is my prescribed wellness travel, corporate wellness, and running retreats and workshops that really realign priorities, release tension, and restore a sense of balance. My services are catered towards B2C. I work a lot with overstretched senior leaders, executives, and burnt-out professionals, but I also am moving more towards a corporate wellness because I definitely think that, well, I'll come on to that actually. There are really three profiles of people that I tend to work with. So the first might be somebody who finds it really difficult to switch off. Sort of hands up if you've ever, okay, actually, let's do something. Hands up if you have gone on a holiday this year. Apart from this is not really a holiday. Oh, really? You guys have not gone on a holiday? Oh, that's sad. Okay. Okay, so keep your hands up again. You went on a holiday, great. So keep your hands up if you touched your laptop or computer and you sort of like looked through emails and things while you were meant to be on holiday. Okay, and if you didn't, did you think about work? So it's really, you can put your hands down. So it's really, really difficult, I think, for many different types of people, especially entrepreneurs, especially people who are running businesses and people who are in this culture where you're expected to be on all the time. You know, you've got your manager telling you, I'm going to send you an email at 8 o'clock on Saturday, and you don't feel able to kind of push back and say, no, I need to rest. So I work with this sort of profile of person. Also, frequent business travelers who are affected by persistent jet lag, and persistent jet lag can be quite difficult to manage, but we manage to sort of help with the poor concentration and things like that with the CBTI programs. And then the last kind of profile, the more common profile, is someone who has reached that level of burnout where they have complete decision fatigue. Now, we're talking about senior leaders, execs, and people like yourselves. You make decisions on a daily basis, and most of us are making life or death decisions. And imagine if your brain, I don't know if anyone's ever suffered from brain fog, I have. I actually thought I had dementia, like early onset dementia. It was really awful because I couldn't think. I couldn't make a decision about what I wanted to eat, let alone how to help my patients. And some of these people, they're very unfamiliar with wellness travel and the ground level travel planning that's required to really have a holistic holiday. So I help with that. So some of the competitive advantages actually to corporations to partnering with me is, as I said before, people don't care about money that much anymore. There's only a certain amount of money that you need before you start looking at other things that you can get from the corporation or the company that you're working from. And one of those is, as much as the company cares about their bottom line, how much do they care about me? Am I somewhere where I'm thriving and I'm encouraged to, look after my whole sense of self? So partnering with me with the prescribed wellness travel can create this hyper-successful workforce who are loyal to you, and they're more productive, they've come to work, they're more rested, and you're able to actually not only attract, but retain staff. And I think the biggest thing for corporations and companies is that you can actually, through the corporate well-being programs and prescribed wellness travel, if you use your corporate social responsibility budget, that's a tax break. So I feel like that's when people tend to go, ooh. So these are some ways to work with me. So I'm really on a mission to recruit enough medics to, by 2024, help enough 100,000 professionals really overcome burnout, be able to detox from technology and build these positive life coping skills through travel that they can transfer onto the workforce and actually be rested and productive and balanced employees. So I will be running I think I was talking to a few people before, I will be running a travelers therapy mastermind at some point. If that's something that you're interested in, it sort of is more of a deep dive into where I'm going and ways of collaboration that would be amazing. Connect with me. As I said, corporate well-being. I also am looking for brand ambassadors. So if you're someone who's quite social savvy, as I said, I'm a bit of a TikToker and Instagrammer. So I feel like it's great to do this health promotion in outside of the insular realm of LinkedIn. So if that sounds like something you're interested in, definitely hit me up. And if you're somebody who's burnt out, if you are somebody who feels as though you cannot break this cycle of overwork and overwhelm, and you need a bit of help, and the idea of actually traveling to boost your well-being, and then having that opportunity to have a really high impact coaching so that you can take these learned experiences and transform them into your life, message me and we can definitely put something together. So I think I've done quite well actually, finishing in with 1 second to go. So thank you very much. So thanks. Thank you. So I hope that was interesting. I mean, does anyone have any questions that they would like to? Okay.
Yeah, thank you. Quite inspiring and amazing. Thanks for your work there.
Thank you.
Concerning the data on travel, I mean, there are lots of publications out that show that the more you travel, the more you have had health issues. So when you compare travel, for example, work travel, and you compare people with 1 to 6 days compared with 20 days, they always have more health issues. Also, you put some of these on your slides. Also, jet-lagged, immunocompromised, compromising stuff. So there is also conflicting data about this out. Could there be a bias also that people who can travel have a better lifestyle because they can afford it? Because this is a very important bias that should be mentioned, I think.
Yes.
And the second thought, you also said it, actually if you have a burned out patient, then you need to break this vicious circle. And this can be done by a lot of different things. And wellness travel is of course one thing where you take the people out, but the most important thing is how to bring them in again. This was what you, I think, meant with the cognitive
The coaching afterwards, exactly. Because it was a lot of this is through my lived experience.
Yeah.
And my experience of, I would travel after I got to the stage of overwhelm and burnout. Then I would build up resilience. But when you think about resilience and let's say you've got two different types of people, and you've got one who's like a hard, those hard rulers, and they barely have any give. So if they break, they break hard, and it's very difficult to get them back together. And other people are a bit more pliable, like those bendy rulers. And I think for a lot of people, yes, it might seem that travel is inaccessible and it's something that can only be accessed through wealth. But when we're thinking about wellness travel, it does not have to be that you're going to Rwanda. There's a lot of different ways that I work with clients to be able to fit in a package that works in their environment, or somewhere that's a little bit more local, so that they are able to access this. And that's something I was talking about yesterday, actually, is how I can get this to be recognized as a form of therapy that actually GPs can prescribe in a way that is accessible to people. So I hope that answers your question. And if it doesn't, message me later.
Forget message. Go outside for a coffee. Keep this conversation going, girl. Dr. Noreen, give her a round of applause. We're wrapping this one up so we can keep the agenda going. Thank you. Well done. There's a real estate company in town that an architect is now promoting this idea of space and the impact of space on your psyche, right? So it's about, there's all this research as well, even from the health industry, of people recovering from surgery, going into a hospital environment with walls on each side versus going into an environment with nature, and how that impacts actually the recovery time and actually how they're feeling and all the side effects that come with some of these post-surgical operations. So really interesting stuff. It's the wave of the future. I think it's definitely, Dr. Noreen, ahead of your time. So well done, girl. I like to hear these type of things that are shifting and changing the industry.